Hi, everybody. Welcome to today's community chat. I'm Becks Heyhoe-Khalil, the Director of United and Homelessness with Orange County United Way, and I'm really looking forward to today's discussion. So today we're going to do our format a little bit differently. So we're going to have a presentation first, and then my guest today, Doug Becht, we're going to have kind of a Q&A back and forth about the findings that we're going to hear about. So really excited that today's conversation is going to be about the new study that the Office of Care Coordination recently released. It's called Falling Through the Safety Net: Understanding Individuals' Journey and Contributing Factors to Homelessness. So it's an in-depth look into what was happening to somebody before they fell into homelessness, with the hopes that we'd be able to identify some system gaps and some good calls to action for us when it comes to homelessness prevention. And so with that said, I'm delighted to introduce Doug Becht, the Director of Care Coordination at the County of Orange, who led the charge on this. And so he's going to walk us through a quick presentation of these findings. And then when he's wrapped up that presentation, I'll come back to join him for a conversation around what this means for our community. So Doug, I will pass over to you to introduce yourself and then walk us through the findings.
Yeah, thank you, Bex. Hi, everyone. I'm Doug Becht. I'm the director of the Office of Care Coordination here at the County of Orange. Our office is the county's sort of central hub for coordination around addressing homelessness. So I appreciate everyone giving me a little bit of time to present on today's study, which, our office has basically gotten into a routine now because Orange County does the unsheltered point in time count every other year. We've used the off years to conduct more expansive surveys of the population. And this year, we're really looking at areas of prevention. So I'll let me share my screen here. Perfect. And I think we got it. All right. So yeah, thank you all for giving me some time today. As we proceed through the results of the survey, I think you'll understand why we titled the survey "Falling Through the Safety Net," because what you'll see is how many people have fallen through the different areas of a community safety net and that to end up experiencing homelessness. Um, Let's see. Our original goal and motivation for the survey was to understand the journey of people who fell into homelessness in the last year, because we saw an alarming statistic in the 2024 point in time count that stated over 48% of unsheltered folks reported becoming homeless for the first time in the last year. As the planning of the survey evolved, we realized that we shouldn't miss the opportunity to understand everybody's journey into homelessness, everyone meaning everyone experiencing unsheltered homelessness, but also ensure that we capture data around when people first started experiencing homelessness. Before diving into the results, it's important to mention and thank some partners. This was not an effort we took alone. CityNet did a lion's share of the work by helping us create and test the survey, as well as being the ones who conducted the survey over the course of March 2025 throughout the entire county and then compiled the results for us. So they really did so much. The Commission to Address Homelessness and the Orange County Continuum of Care helped shape and support the survey, specifically through a joint meeting between the two groups where extensive feedback around the survey itself was given before CityNet started surveying the county. We're excited to talk later about what next steps with these results look like. Additionally, the city's law enforcement and outreach providers played big roles for us in partnering and ensuring that we were able to actually go out there and collect the surveys we were looking to collect. Also, want to give a quick word about the methodology. As we did in 2023, our goal was to survey a sample size representative of 20% of the unsheltered population reported in the most recent point in time count. And for this survey, that was the 2024 point in time count. And to ensure geographic equity, we surveyed 20% of each city's unsheltered point in time count. The survey, which was created through a several-month process and went through many groups, including the COC's Lived Experience Advisory Committee, was a little over 70 questions, requiring respondents to answer anywhere from 50 to 70 questions based on their answers and conditional logic. CityNet deployed their team of professional survey administrators all throughout the county during the month of March to collect the 840 desired surveys. Um, it, the respondents averaged about 18 minutes to complete the survey, and CityNet worked with our office over the over the course of the next couple of months to review and report on the data. I want to note two important limitations to our survey, and I might periodically highlight them throughout my presentation. First, it's important to remember that this is a self-report survey. So all the data is based on what each of the respondents reported on their survey. And second, it's really important to remember that the only people responding to this survey were those who fell through the safety net and ended up experiencing unsheltered homelessness. We know that there's thousands of people who experience the risk of homelessness, that our community helps them avoid homelessness, that are not represented in these results. So I caution anyone to assume that these results should be taken as the sole report on our system, specifically our prevention system. It's really capturing the answers of a very specific cohort, those who are experiencing unsheltered homelessness on our streets. In terms of participation, we saw another high percentage. When I say another, I compare it to our 2023 survey where 76% of the people that we came across, or 77% of the people we came across ended up completing the survey. This year, 73%, so in the same ballpark. I think we should note that this suggests a few important things. People are interested and willing to tell their story. They want help, and they trust our system, especially CityNet, with sharing their personal experience. This is all good signs about our system and the people that are experiencing homelessness. As I mentioned before, we ensured geographic equity by surveying 20% of each city, 2024 point in time count, combining for 840 surveys. Speaking of equity in comparison of the 2024 point in time count, as we looked at the different demographic categories of the people we surveyed here in 2025, we saw strong alignment through all demographic categories, leading us to feel comfortable reporting that these results are a good representation of all the people experiencing unsheltered homelessness in our county. So let's dive in. So here we answer the first question about how long people have been experiencing homelessness. As we see right off the bat that the length of time varies from less than a week, 7% of those folks, to 4% reporting they've been experiencing homelessness over 20 years. These results also seem to suggest that that interesting 48% statistic that we saw during the point in time count might be an anomaly in our statistics. You know, the reason we were so interested in that 48% stating that they're experiencing homelessness for the first time in the last year, the reason we were so interested is because that was such a large response compared to any other time we've asked that question. So what we're seeing here is maybe 2024, that data point was a little anomalous. So now let's, that we have a little idea of how long people are experiencing homelessness, let's get into their journey. We are going to really look at 5 key steps of that journey. First, we're going to understand what life looks like before someone fell into homelessness. Then understand how they became homeless, asking them what they did to avoid it, what could have helped, and now finally what life looks like now, which really helps us compare, and you'll see the difference between life when housed compared to life when someone's experiencing homelessness. So as we look at people's lives before experiencing homelessness, we see that 44% of people reported living with friends or family, with another 37% of people stating that they were renting an apartment, a house, or a room. Surprisingly, the third most popular response was home ownership, or at least surprisingly to me. A little over 6% of people said that they were living in a home they owned. When we asked if their name was on a lease or a mortgage, we saw that 62% of the people either staying with friends or family or renting an apartment um, stated that their name was not on the lease. Um, but 75% of the people who said that they lived in a home they owned reported their name was on the mortgage. So um, yeah, just interesting and under to see that so many people that were either renting or staying with friends, that they were not their name wasn't on the formal lease. Mm. We also found some interesting data when it comes to income prior to experiencing homelessness. Over 75% of the people they um, uh, reported having an income, and 80% of those folks reported having an earned income, so that they had a job uh, to some extent before experiencing homelessness. Um, when when we shift to look at first how much income they actually made, and second, how much they paid towards housing a month, a narrative starts developing, which we will see throughout the data. For monthly income, although a lot of people reported earning an income, almost all of them, above 90%, are not making even the median salary of an individual. 71% of them are making under 3,000 a month. 54% of them were making less than 2,000 a month. And then when you transition over to what they are paying into housing, for obvious reasons, because their income is very low, 43% were paying less than 1,000 a month, and another 20% paid anywhere between 1,000 and 2,000 a month. So they're paying less than the um, average rent for a one bedroom here in Orange County, which is over 2,400 a month. So we see financially, before we even get into other contributing factors in their lives, they're arguably doomed, unable to afford a place, and arguably showing that it's almost a matter of time before falling into homelessness unless there's intervention. We also looked at system involvement before experiencing homelessness, and we saw some interesting numbers that 45% of people said that they experienced incarceration before becoming homeless, and the national average is about 5% of the general public experiences incarceration in their lives. Probation and parole, you'll see another big variance there. 9.8% said they lived in subsidized housing before becoming homeless, which is over double the amount of the national average. And then we see childhood poverty rates high and foster care high. So, you really see how there are a handful of challenges that people are facing in their lives prior to becoming homeless. We also asked about disabling conditions prior to becoming homeless, and you'll see here 8% stated having a cognitive disability or being diagnosed with one, 15% emotional or behavioral disability, and then 17% a physical disability. Uh, uh, so we also asked about trauma, and what you'll see here is that over 70% of people stated that they had experienced one or more traumatic events in their lives. And out of that 72.5%, three-quarters of them stated that that traumatic event played a role in their homelessness. So yet again, we've got system involvement, we've got financial challenges, and we have trauma. So a variety of challenges people are facing. So now let's move to what happened and what contributed to them becoming homeless. So we asked people about what factors contributed to their homelessness. And here, people could have selected more than one factor contributing to their homelessness. In fact, 78% of people did select more than one contributing factor. On this slide, you see that nearly 80% of people stated finances contributed to them becoming homeless, 60% reported relationships as a factor, and over half stated that health and safety were contributing factors. When we look specifically at what financial factors, they reported the cost of housing was selected most. Financial support or decreased income is second, and a lack of affordable housing third. We see that an argument or a falling out was the highest selected description of a relationship factor selected, in front of 25% of people referencing divorce, separation, or breakup. When we asked people to choose the most impactful to them falling into homelessness, finances received the most, but right behind it was relationship. I think this represents two important points. We keep seeing and hearing that finances are the biggest factor in someone falling into homelessness, but this data also shows how people's journeys are unique, with other categories playing a significant role as well. We also asked why people we also asked the amount of notice people received. And what we saw here was that most, 62%, reported having less than a week's notice that they were becoming homeless. And before we jump to any conclusions around that, we looked, okay, out of that 62%, where were they living prior to that homelessness? And almost half of them said they were staying with family and friends. So they weren't renting an apartment. They didn't have, potentially a formal eviction process wasn't what landed them into homelessness. And when we also look at the main factors contributing to these people's homelessness, what they said the main factors was financial factors played a role, but also relationship ticked up a little bit here as well. So, my immediate thought when I saw 62% didn't have had less than a week, I thought, oh man, these are landlords jumping on evicting people quickly. And that's really an unfair characterization of this. It's a lot more nuanced and complicated. So now when we move to what you do to avoid it, here we see another really alarming stat. Only 12% reported seeking help before they became homeless. Now, I'm sure that this is greatly impacted by the little notice they had in regards to becoming homeless, remembering that 62%, like in our last slide, stated that they had less than a week. I also wonder and hope that this might be a good sign that our system's working. And what I mean by that is that hopefully the reason we have such a small percentage of folks saying they look for help was because a very large percentage of folks that did look for help actually received help to avoid them experiencing homelessness. So hopefully this is a sign that, if people seek help in great numbers, they are able to avoid it. Not sure it's a jump, but I'm trying to be optimistic. When we look at the 12%, what they received, you'll see that the top response was food pantry and meals, which is important, but not something that directly keeps someone housed. And then we see a variety of services at a lower percentage that provide help, but obviously not enough to keep them from becoming unhoused. As we shift to asking them what would have helped, the overwhelming number of responses spoke about the ability to afford housing. 6 out of the 7 top answers, as you can see here, gave responses related to having a house they could afford. Yet again, regardless of everything in their lives, when you're strictly asking the question about how do you avoid losing your home, the top answer is I need an affordable place and I need to be able to afford it. As we look here, and when we had asked people about, and you saw in the response in the previous answer, folks stating that rental assistance would help. We asked how long would they expect would they think they would need in terms of rental assistance help. And 31% or 32% stated they would need 12 or more months of rental assistance, and 40% said 6 months or less. This is one of those areas where the self-reporting, and I wonder, this captures what their response is. From my professional experience, I believe that more assistance would probably be needed. Um, Looking at what is needed to prevent homelessness compared to delay it, um, uh, what we saw was people yet again stated that the help they received was good, but they needed it longer and they needed more of it. Um, so lastly, we look at what life looks like now and how it compares to their prior experience becoming homeless. First, I want to point out that household composition changed quite greatly. Prior to becoming homeless, 225 people reported living in a household with children, but only six people reported having children in their household when they were now that they're experiencing homelessness. Now, I want to be clear here. Our question didn't state whether or not the 225 people who said they lived with children, whether or not it was their children or they had custody with them. But essentially, they lived in a house with children. Um, I think there's a couple of things here. One could say that this is somewhat positive in the sense that children aren't coming along this journey into homelessness. Um, but that's probably the only silver lining here. I think there's obvious conclusions to this or impacts, but one that might not be, and I think that's important, is the impact of the household composition, even for the household that was able to stay housed, um, how their household composition changed when people left that house and the impact we know that that has. And then we also should point out that the challenges of isolation and isolationism that we see on the street when people become unhoused. Their safety net continues to erode, and this is one of those examples. I think what's really interesting in this study as well is this slide here. We talked about income prior to becoming homeless, and 61% of the respondents stated they had an earned income. That shrinks before they became homeless to less than 8%. Um, General relief, GR. Um, People lean on that at a much greater rate when they become homeless compared to prior. No income almost doubles the percentage, over doubles the percentage. So I think this really points out how, yet again, people's situations go from bad to worse when they become homeless, and the the need of the system, the government and nonprofit world to come and provide assistance greatly grows when someone falls into homelessness. We also have interesting data here. We see a slight uptick of people reporting uh, during their homelessness that they are diagnosed with a cognitive disability while experiencing homelessness. Another 14.8% report that their diagnosis of emotional behavioral disability comes when they became homeless, and another 14.2% state that their diagnosis of physical disability comes after they became homeless. Um, um, and then finally, we asked folks about if they had friends or family they could reach out to for help at the moment to help secure stable housing. And 4 out of 5 said no. And those that did say yes did say that they were getting financial assistance, which is really helpful. But 4 out of 5 people don't have anyone they could reach out to for help. Yet again, speaking of that safety net, it really erodes. So finally, some of the key findings we saw very much at the high level, and I hope comes across as somewhat obvious here is after hearing this survey, the factors and journeys into homelessness really varied. And prior to homelessness, people had areas of vulnerability and system of involvement already. Safety net resources and programs were not accessed prior to becoming homeless for many of these folks. And the financial factors really were the most significant in most individuals' paths to homelessness. And finally, what I'll point out is that these results really are consistent to other surveys that we've seen statewide and nationally. So with that being said, I know I got through a lot here. I appreciate everyone sitting through it, and I'll pass it back to you, Bex.
Thank you so much, Doug. I know there's a lot of information that was packed
Yeah.
in there, and so I appreciate that sort of that slide at the end that has some of the key takeaways. And I guess the first one that I want to kind of talk about is as you were going through this, as you were talking about, some of the factors that happen before somebody falls into homelessness, it immediately reminded me of the cost study that United Way, along with Jamboree, commissioned UCI to do. And that was about 8, 9 years ago. And that study showed that housing affordability plus people, not earning enough money to afford the housing that is available. Those were the top two reasons in that study. And then family dynamics was the third reason. So death of a key member of the household, separation, divorce, and domestic violence. And so that's one study that we can certainly drop a link to in the chat box that really lines up with what you were sharing. You mentioned some other studies. Can you share the names of those with us?
Yeah, the main one is the Benioff study that UCI did the not UCI, I'm sorry, UC San Francisco, the Casper study done roughly about a year ago. The thing that that showed that finances and some financial help would really help people prevent themselves from falling into homelessness. I think as we've shared the results of this survey amongst a variety of groups, the one thing I want to be really clear about is that we point out that, and I think you did a great job, Bex, just here, that finances play a really big role at the end of the day in being able to secure someone's housing. That does not mean that um, other challenges in someone's life isn't impacting their ability to be able to pay for housing or be able to afford it. And what I mean by that is that clearly someone who's battling with mental illness or substance use is going to be challenged in affording housing if they're unable to maintain employment or access benefits. So I say all of that to say that um, prevention is a wide-ranging field, and it requires that we have a variety of services. A good example of that is if I could help someone with their mental illness manage it better, for lack of a better term, that means that they'll be able to potentially stay employed longer, earn a better income, and now be able to afford that housing situation. Or if I'm able to help someone address their substance use, that may be the significant factor in being able to help manage the relationship that they're having at home that will allow them to stay housed. So I think it's important, and the point I want to get across is that finances are incredibly important, but that does not, just because they're incredibly important, doesn't devalue the importance of providing the other services that help people stabilize their life.
Absolutely. I mean, we're whole people, right? As you
Mhm.
were kind of sharing,
Absolutely.
Doug, there's so many pieces of a person's life. And I do think that the slide that you put up, though, is such a helpful one around the emotional behavioral disability, 14.8% of people saying that that was something that they were living with prior to becoming homeless. But then the same amount of people have experienced that after they've become homeless. And so, absolutely, we need to focus on the whole person. But as you were kind of going through this, I was just reminded again of the smaller percentage of people who fall into homelessness having that diagnosis before they fell into homelessness. And again, that reminder as you were sharing about the impacts of homelessness once somebody has fallen into that. And I know I've heard this presentation a couple of times, but the one around income, 60% of people having earned income before experiencing homelessness, and then after they've become homeless, drops to 7.6%. That was one of the things that jumped out to me today in your presentation as such an important piece around debunking some of the misperceptions that people have. Yeah, anything you'd like to share on
Yeah,
those
I think
topics?
this is where, things can be complicated and simple at the same time. And you think about it, like if I were to lose my house and became homeless like right now, it would be really hard for me to stay in this job or any job. Now, the reason I lost my housing could be due to a whole bunch of reasons. But just the mere fact that I lost the housing would impact my ability to come into work every day. So, you see the ripple effects. And I think, for me, when I look at the before and after income slide, thinking from a systems level, we think about the importance of keeping people in a situation where they're stable and housed allows them to go about life in a much more independent way, that where they don't need help from us. I'll say us, the county or local government, and that's what we all want. I think that that's a really important takeaway.
Thanks so much for digging in a little more there with me. I know you've provided this presentation in a couple of different places. Could you just share with our audience who's heard these findings so far, any feedback that's being received, or any next steps that are happening as a result of these?
Yeah, so we've had the opportunity to present to a bunch of groups. First, for a county department, I always say we were able to present to our board offices. The board offices meaning our board of supervisors offices, which they all found really interesting and enlightening. We also had a presentation both at our commission to address homelessness and our COC. And then we followed that up with a in-depth presentation at a joint meeting between those two groups. So our COC is filled with leaders throughout our community, both on on the government side, on the nonprofit side, on the lived experience side, just a really dynamic group. And our commission is a 21 member board appointed body that has a bunch of executives from several different sectors as well, including elected officials, the district attorney's office, um, the faith-based community, city leaders. And what was really interesting is I guess with any study, but especially this one, is you bring together groups of people that come from different spheres of influence. You start to see, especially when you talk about the large required system that a community needs to have for prevention, you see how each sector sees this data differently and takes different, you know, different takeaways from it. I think for us, as we think about where this data is going or how it has been influential, I think we're just starting to see the impact of it. And what I mean by that as many of you know, there is significant changes happening both at the state and federal level when it comes to not only funding, but policy around addressing homelessness and helping people, who are in need that are at risk of homelessness. And I can speak for myself in my role as someone who works closely with our board of supervisors and the uh, leads in many of the departments here at the county level. This survey has allowed us to provide more detail about the folks that are experiencing homelessness and that are falling into homelessness, but specifically what their exact needs may be. And it really highlights and validates the investment that our community has put into many of the safety net programs that we call our system of care here in the county. So that means the importance of behavioral health services, the importance of people receiving benefits. As we know, we're looking in the longer the federal government's shut down, I believe the number is over 300,000 households here in Orange County rely on CalFresh um, benefits, and those are potentially at risk the longer this shutdown goes on, even meaning within the next couple of weeks. And I think that a survey like this is a reminder of how um, even one piece of the system being taken away can really inch people closer to homelessness. And with that reminder, it hopefully reminds our community how important it is to help folks um, in each one of these areas.
Absolutely. And I think if that's one thing those of us in the homelessness sector are so aware of is that precarious balance. And that those who are at risk of homelessness, like that, it is such a thin line between being housed and becoming unhoused that that this survey clearly shows, and how important these safety nets are that we have in our community to help keep people housed. And I will just share that if anybody is watching this who is concerned about a loss of benefits or concerned about what may happen around CalFresh, just want to kind of remind everybody you can call 211 to find information about food pantries and food resources that are available in your local area if that is something that anybody watching is concerned about. So just want to kind of drop that in there for anybody who heard what Doug was talking about and is concerned either for yourself or for somebody that you care about. Um, I want to pivot us a little bit, continuing kind of same kind of vein, but so based on this study, as you're looking at this, taking into account the information that we have here, combined with the California studies, the national studies, what upstream or early interventions could be looked at in the future to help prevent people from falling through the safety net in the first place?
Yeah, so there's a variety of things. And I think as I've dived deeper into this, I guess what I'll say, I've grown a greater appreciation for the work that many of you on this call and many of my colleagues throughout the system of care provide. Um, you see the data about incarceration prior to uh, becoming homeless, and the importance of providing people with a safe space. I think the thing that makes me most nervous moving forward um, in these times is being able to help people that are unable to earn an income or have an income that will sustain their own housing without assistance. Um, essentially, programs that are at risk of rental assistance. So essentially, we're seeing impacts at our public housing authority, at our public housing authorities. And we know that thousands of households here in Orange County um, rely on the assistance of a public housing authority or a Section 8 voucher to help pay rent every month. And it's so incredibly important um, that we as a community are aware of the changes that are happening at the federal level that are eliminating funding for programs like an emergency housing voucher system um, or the COC programming funding. So what I'll say is you don't need to know the particulars necessarily for this call or for the point that I'm trying to make, but essentially what we know is that every time a resource like that is cut, a community or local government is forced to figure out how to compensate for that particular cut at the federal level. Um, and what we're seeing now is we're seeing a lot of cuts at the state and federal level that here in Orange County, we're having to find alternatives or repurpose resources that we wanted to help future households with that we're required to now utilize to just maintain housing for those that are needed. So this is just a really critical time for people to be aware of what is going on within their government and what programs are and are not being supported.
Yeah, thank you so much for that, Doug. And it reminds me of the conversation, yesterday at the Continuum of Care board meeting about the COC funding. And so my team, Alejandra's just popped a link in the chat box. So what Doug was referencing are potential very significant cuts to the continuum of care Funding at the national level is being reduced almost by 2/3, which of course will have an impact on local communities. And then also they're talking about making a change to how much of your local CRC funding could be used to help with rental assistance, and that would have a devastating effect on our community. So we have launched an advocacy campaign. If you haven't sent your letter yet through that, please click on that link. There'll be more information on that link about kind of the details of what Doug was referencing and I've been talking about. But we would strongly encourage, United to End Homelessness would strongly encourage you to sign on to that letter. Um, Doug, a lot of the people that are watching come from all kinds of different walks of life. We've got faith leaders on this call, we've got business leaders on this call, community members. Is there anything that you would sort of suggest to people who are wanting to figure out how to use their voice, where to use their voice, to talk about these things?
Yeah, I think especially at a time like this, we need people to stand up and use their voice and state what they believe in, especially for those of you that feel strongly about the importance of helping our most needy neighbors. The 211, Orange County United Way and United to End Homelessness is really the vehicle from my perspective in terms of advocacy right now in this area here in Orange County. So, exactly what Bex said, and I really appreciate Bex and her leadership in this area to ensure that we are creating a place for a collective voice here in Orange County. I think it's important, not only in Orange County, but I think when you have a place, any community, but especially here in Orange County that's voicing their support for helping our neighbors, you have to remember it also uh, lends support to surrounding communities throughout the country to know that they're not the only ones experiencing this, and that they're not the only ones who support um, the importance of these programs and helping our most in need. So, yeah, please, if you feel strongly, please go to United to End Homelessness website, click on the links that Bex put in the chat and Alejandro. Uh, I think that is the easiest and most effective way to get your voices heard. And feel free to, share this information amongst your group, your sphere of influence, or the people you talk to. The more folks that are talking about this topic, the more likelihood we will, see some change for the better.
Yeah, thank you so much for that, Doug. And yeah, we are grateful for the partnership around the advocacy efforts here. And I am going to ask Alejandro on our team. He helps to lead our advocacy efforts. And so if you're watching this live, and you're thinking, I didn't know about this, somehow I didn't get the memo that we needed to advocate for this. He's going to pop his email address into the chat box, and he would love to hear from you. If you are a faith leader, if you're a business leader, if you're a city leader, and you are kind of hearing this and you want to know more information about the various advocacy actions that are happening, please send him an email to make sure that we can get connected, because we don't want to miss anybody who wants to be a part of using their voice. I know that we have gone over time, but I also know that we still have a lot of people who are tuned in. And so I'm just gonna ask you another question, if that's okay, Doug. And
Absolutely.
then then I'll wrap us up. This is such an important discussion, and we have so many things that we could talk about. Um, this is a challenging time right now. We're in the midst of a government shutdown. We're looking at potential significant changes to funding that's available to address homelessness in our community. And so, Doug, as a leader in Orange County, from your personal perspective, what's giving you hope right now as we're looking at this? It's easy to feel disheartened, But I think it's always helpful to hear from a leader in the space around what's bringing you hope right now.
Yeah, that's I guess an important question right now as we see um, really what I'd say at the federal level, not only the funding cuts, but the changing in policy and the changing in messaging around who's experiencing homelessness and really criminalizing it at a federal level. What gives me hope is as we're, as our office is informing, whether it's our board or other, affected stakeholders about potential cuts, really across the board, the feedback we get, regardless of where people may stand politically, is the recognition of how important it is to help people experiencing homelessness and how funding is really critical in being able to help those people. So, yeah, I am appreciative and hopeful as I see, at least our local community of leaders who come from many different walks of life, recognizing that we've made real progress here in Orange County over the last 10 years, and we do not want to take steps back. And we've made that progress through collective investment um, at many different levels, and that has been our solution that has worked. And if we move away from collective investment in these programs, that we will start to no longer see progress being made. So having that general consensus has brought me hope.
Yeah, I really echo what you're saying. It was so encouraging to hear, the in particular the commission members on the commission to address homelessness when this was brought up to them, to hear from pretty much every commission member who spoke spoke about the importance of making sure that we can find other funding to make sure that people can stay housed, and the concern around the impacts that this would have on the system. And I know that concern comes because they know the system that we have created here is so important, and so much time and effort has gone into creating this. It's not perfect. Nothing is perfect. There's always room for improvement. But it would be just devastating to lose any aspects of this. And so I guess I will just say yes and thank you for identifying that as a source of hope. Doug, I guess my last question for you, is there anything about the survey and the findings that you didn't get a chance to reference? I don't want to leave you with a key thought in your mind that you didn't get a chance to share.
I think the only thing I didn't get a chance to share that I should have, which is the point that these results really put a face to people that are falling into homelessness. I think what I've seen, what I've heard back from people who've looked at these results is it it, it reminds you that real human beings are facing real, honest challenges that really deserve some compassion and some assistance to help them get out. So that's the piece that I want to really emphasize, and I think has been really valuable, is that it's really put a face on these folks. So.
Thank you so much for that. That wonderful closing thought for us, Doug, reminding us that every human being should be treated with dignity and respect, and that people who have found themselves without a stable roof on their head are people just like you and I. And so thank you for that wonderful way to kind of wrap up this conversation and end in dignity. Um, for those who are watching, I do want to invite you to an event on November 15th. And so, as kind of Doug and I were saying, this work is hard, and we recognize that. And oftentimes we don't get to meet with other people who believe and want to kind of create an Orange County where everybody has a safe and affordable place to call home. And so this year we are partnering with the Orange County Soccer Club and about 70 nonprofit agencies here to do an event. Can we go back to the other slide, please? To do an event where we are going to be creating a beautiful kind of aerial image together. So this is a chance to come out and meet hundreds of people in Orange County who care about this. So November 15th in the morning, we'll have a cup of coffee for you to welcome you. Um, and so you can register. The QR code will come back here. So you can register here or go to thepersoninfrontofyou.com to sign up. It's kid friendly, so bring your kids. It's going to be such an incredible opportunity for us to be able to look each other in the eye, cheer each other on in the work that we're doing around this and kind of just keep that hope and passion ignited in our hearts together. So I want to make sure I invite everybody to attend this incredible event. So if you watched this and you thought to yourself, my goodness, I know a lot of other people that need this information, this chat will go up on our YouTube shortly, and so we will share that on our social media, etc. once that is up and live, because we know there's really important information that Doug shared with us today. We will have a quick little poll is going to pop up on your screen. We always find this really helpful as we're planning future community chats. And talking of which, I want to let you know that our next community chat is planned for November 7th. I did it. And we are actually going to be talking to the artist that helped create the little guy that you can see there for this campaign. Incredible local artist who has been doing a lot of the design work for a little TV show that you may have heard of, Stranger Things. And so we have had an incredible partnership with him, and we can't wait to introduce you to him to learn more about why he decided to get involved with this and to hear more about what's happening. So thank you, everybody. I know we ran over, and so many of you stayed with us. Deeply appreciate it. And look forward to coming alongside all of you to build an Orange County where everybody has a safe, stable place to call home and opportunities to thrive. I will see you next time. Thanks again, Doug.